Good morning, everybody. I am David Paul. I am the chair of the Delaware Healthy Mother-Infant Consortium, and I'd like to welcome everybody to our 16th annual summit. Really hard to believe it's been 16 years. We have a great program today. I'm really excited. I'm going to introduce you to in a minute to the co-chair of the Delaware Healthy Mother-Infant Consortium, Susan Noyes, who's done the yeoman's work in planning today's event and really has prepared a special agenda for all of us in the state of Delaware. Every year we invite national speakers to this summit so we can learn more and make sure that we all have an awareness of the most up-to-date thinking in maternal child health in our state. Our ask of you as an audience is pretty simple, and it's really in the name of today's conference. We ask that you listen, that you connect, and that you inspire. I'm going to tell you some really good news at the end of the day about our infant mortality rate. Maybe actually Lieutenant Governor Bethany Halong is going to break that news today, and we'll review it again at the end of the day for those who aren't here early in the day. Today we're going to really focus, as usual, on equity. And I think what's a little different this year is that you're going to hear the voices of our DHMIC members loud and clear and strong throughout the day, and really happy to feature those strong voices throughout the day. I also want to let everybody know that I think what they're going to hear today may make them feel a little uncomfortable, and that's okay. We learn from that discomfort. We reflect on that discomfort, and it's something that really works to make us better. So without further ado, I'd like to turn it over to Susan, who's going to introduce a special feature of today's program, a graphic artist that we're going to have throughout the day. Susan, and again, thank you for everything you've done to plan today's events.
You're welcome. Good morning, everyone. So nice to see you all. This has been I feel like a gestation period of having a full-term infant of 9 months as we do the planning for this event. So it's good that we are here. And I agree with David. Welcome on behalf of the DHMIC. So this year we have a special feature. I would like to introduce you to Rio Halliday. Rio is our graphic recorder, and she has a background in public health and social justice. And she is the culture of health leader at the Robert Wood Johnson Foundation. She began this career in graphic recording as she had a career in public health because she believes in the value of listening and witnessing. She wants people to feel like they are heard and making conversations accessible. And she believes that that's a much needed change. Today, Rio will be listening to everything that is said by our keynotes. She'll be checking out the chats a little bit also. She'll be synthesizing these themes, the conversations, and the quotes. And then she's documenting that using the conversation and different images, which you will see during different Q&A sessions or definitely at the break time. And then at the closing, please stay with us all day, and you will see Rio present all the graphic recordings that she's made throughout the day. So welcome, Rio. We're glad to have you here with us in Delaware. And she woke up from California, so thank you for waking up bright and early. David, back to you.
Thank you, Ria. Hope you have some strong coffee on the West Coast. And I'm just back from Colorado and from the academic pediatric meeting, so I can feel your early morning, jet lag. I guess you're not jet lagged. I'm jet lagged. All right. So without further ado, I'd like to introduce Lieutenant Governor Bethany Halong. Lieutenant Governor Bethany Halong has been a great champion of maternal child health in the state of Delaware. She is a former member of the consortium, a nurse, and thank you for everything you've done for women and children in the state of Delaware, and glad to have you with us this morning.
Great. Thank you so much, Dr. Paul, to Rio and to our friend Susan, as we all are wearing our shirts today. I hope that the participants who signed up received their Listening, Connecting, Inspiring Change t-shirts. I am thrilled, as you said, Dr. Paul, to join the incredible Delaware Mother-Infant Consortium. It is amazing as we look back to when it was created in 2004 with then our Governor Minner and Lieutenant Governor Carney at that time, and when we had such incredibly high infant mortality rates. And kudos to everyone today think about the theme: listening, connecting, inspiring. Listening as an OB, former OB practice nurse, now in population health, public health, teaching at the University of Delaware still full time. I know that innately in utero, listening always is one of the first things we have, and biologically as we leave the world, listening. And it is so incredibly important that we listen, that we connect, and that as we're working in communities across our state, the one thing I have learned, of course, during COVID and before COVID, we all knew, is that we had disparities and we had such inequity. And thank you to the Mother Infant Consortium and to you, Dr. Paul, and to the incredible team who every day, you lean in and want to address inequities and want to make sure women and children in this state have the same opportunities at birth and preconception. So to all of you who are doing prenatal conceptual outreach, education, to the ambassadors on the street, to our researchers who are really leading the way, because we know that listening and connecting makes a difference. During the pandemic, Dr. Rattay, Secretary Molly McGarrick, our governor, all of us came together, including you, to protect ourselves from the virus. And we recognize services continued. And I am thrilled. And I asked Dr. Paul if he was sure he wanted me to be the one, or if he wanted to deliver some really good news. And it's remarkable to me that even during these difficult, incredible times, that you have been able to make the difference. And so think about those data points. When we started, and here comes some good news. So if you don't have your coffee, get it now, take a sip. When we started this initiative, roughly not quite 16 or so years ago, infant mortality death rate was around 9.3 deaths per thousand. We brought it down in 2019 to 7.2 deaths. Big news that I hope Dr. Paul continues to reiterate and to champion and to thank you. The 2020 data are in, and the 2020 data are 5.5 deaths in 2020 per 1,000. Give yourselves a round of applause. That is remarkable. Just shy of the national average of 5.4. Because of listening, connecting, and working and inspiring and strong leadership, not only with our director of public health, our secretary, and you here, but later you're going to also hear from two remarkable colleagues of mine from the General Assembly, where I spent many years in the House and Senate. You're going to hear from Representative Mimi Minor-Brown, as well as Senator Marie Pinckney, who both are very passionate, particularly when it comes to equity and infant mortality reduction rates focused on Brown and Black communities. So let's listen, let's connect, let's continue to inspire and to really work together for change. So as we're following the various guidelines, as we're working together, as we continue with our responsibility to work, let's really think about how we are going to continue to have equity. I'm really thrilled that today, as a population health practitioner and researcher, that you're going to be hearing from one of the leads in social determinants in our country. It is so imperative. We all know that shining the light of COVID really showed those disparities and equities, but particularly around social determinants and how social determinants and housing and transportation really matter. And we know that sometimes, yes, there is truly the genetic code that makes a difference, but I am convinced that it is often much more the zip code. And so as we are listening, inspiring, and connecting, think about our strategies and specifically in those zip codes so that perhaps we can continue to celebrate and perhaps have even a lower infant mortality death rate in the future. But I just want to end again with a deep congratulations on lowering the rate. A lot of work to go. I really thank you and really look forward to an inspirational day. My office is always accessible, always available, just a phone call or an email away. So with that, Dr. Paul, I will return it back to you.
Thank you, Lieutenant Governor, and we certainly appreciate your strong advocacy and your support, and really the advocacy of the state government and all members. It's been an incredible partnership from the beginning. And when I talk to colleagues throughout the throughout the country, they really can't believe the Delaware way and how we get along and how closely connected we are to our state officials. So thank you for being so ever readily available. Much appreciated.